If you have arm or leg pain, it's commonly called radiculopathy. I know it's a long word. What exactly is that? What causes it? What can you do to fix it? Is it the same as sciatica? Well, we're going to talk about spinal radiculopathy today. It's a term that might sound complicated, but we're going to break it down in an easy way that makes sense. Welcome back to Back Talk with Dr. Ryan. I'm your host, Dr. Ryan Wohlfert, and on each of these episodes, I address the most common questions and misconceptions about back pain, spinal health, how you can strengthen your spine and be your own guarantee for your health in your life. And so today, we're going to talk about radiculopathy and what that is. So remember, with the spine, with the nervous system, and how it works, is the brain sends a signals down through the spinal cord, which is inside the spine, and it goes to every single cell, tissue, and organ in your body. And the nerves, obviously, they go down your arms and the legs as well. So radiculopathy is when you lose, or there's something that interferes with those nerve signals, something that's blocking it. It's like a traffic jam on a highway. And you could get pain, maybe some numbness, tingling in the limbs, even weakness if it is there for too long. But remember, radiculopathy is basically a description of what's going on, not necessarily the actual cause of the problem. So what actually causes radiculopathy? So here are different causes. So it's could be a herniated disc, could be bone spurs, could be this facet joint hypertrophy. That's a fancy way of saying arthritis in these joints of your spine. So the bones get worn down, and you get bone spurs from that, pointing into and protruding into the space where the nerve comes out. And so when that nerve gets irritated by a herniated disc or a bulging disc, bone spurs, arthritis in the spine, that can interfere with those nerve signals going down your arm, going down your leg, causing pain, numbness, tingling, weakness, maybe even loss of coordination in those, because the brain's got to get the signal to the rest of your body. So it needs to know how to do that. Is this the same as sciatica? Well, sciatica is a specific type of radiculopathy. It affects the sciatic nerve, but other possible locations can happen for this radiculopathy in the spine, in the neck, going down the arm, different parts of the low back going down the legs. So it's not always sciatica. So you see, I mean, we mentioned the symptoms already. They're right here. Neck, if it's in the neck, pain, tingling, or weakness in your shoulders, arms, hands, low back. Well, pain, tingling, weakness in your legs, hips, or feet. Can have balance issues, can have coordination issues as well. So the important question is, what can you do? And what I would suggest is, this is be your own guarantee, right? That's what I say all the time. BYOG, be your own guarantee, and dependence on pharmaceuticals and procedures. So we don't, at least I can't tell you not to, but for me, I never want to rely on painkillers, because it's not getting to the root of the problem. It's not getting to, okay, why is the nerve getting irritated? Is it a disc? Is it a bone spur? Is it arthritis? Is there something else? Is your posture out of alignment? Is your spine weak? Are the normal structure of your spine broken down to where it's irritating the nerves coming out of the spine? And so we don't want to just mask these symptoms. And an important and new development, if you will, is coming on, and it's called extension traction. And you can do it in the low back, neck, mid back. There's different forms of traction depending on the area of the spine. But I'm going to show you a couple studies that show how it was used with radiculopathy. So these are going to be really interesting. So first of all, this one study here is extension traction treatment for patients with discogenic lumbosacral radiculopathy. So essentially what that means is the focus was on using a specific type of lumbar extension traction for low back pain caused by herniated discs at L5-S1. So they took two groups. One group got traction and standard therapy, and the other group only got a standard physical type therapy like heat and electric muscle stimulation. So they both got the electric muscle stimulation and heat, but the one group, the traction group, got the traction obviously too. And after 10 weeks, they measured to see what the results were. They, asked them a bunch of questions and with their pain, with their flexibility. And after 10 weeks, the traction group showed huge and much greater improvements in their pain reduction and their spinal flexibility, how their nerves function, like how fast the nerve signals got to where they needed to go. And then also their disability level. So they were able to do life, they were able to do more things. And what's even better, I think, is these benefits remained after 6 months, whereas the therapy only group, they regressed back to where they were. So this was focusing on lumbar extension in the low back. So this was for spinal radiculopathy in the low back caused by herniated discs at L5S1. Here's what I think you're going to find interesting. So this was in the Journal of Clinical Medicine. And so what they did was they wanted to see if helping the neck curve improved low back or lumbar spinal radiculopathy. So right here, cervical extension traction for one-sided or unilateral lumbosacral radiculopathy. So even I sometimes have trouble saying that. Associated with L5S1 lumbar, low back, disc prolapse. So again, disc bulge, disc herniation. So just to reiterate, working on the neck to see what happens in the low back and leg. So one group, again, traction plus standard therapy. The other group, just a standard therapy, the heat and electric muscle stim. After 10 weeks, traction group in the neck. The traction was applied in the neck. Less pain, improved neck function. Again, these benefits lasted after the 6 months. The therapy group regressed back to what they were. So the problem might not just be in the low back. It might be the spinal cord and the nerves are even getting irritated up in the neck that extends down into the low back. Because remember, so think about your nervous system like a faucet and a hose. So the brain's the faucet right up here. And the hose is the spinal cord going down through the spine, and it's going down the legs, down the arms, all your organs, all the tissues in your body, all your muscles, all your joints. So if we have a kink in the hose up here, if it's getting stretched, if it's getting shut down on, then there's going to be less water, well, in this case, electricity or energy from the brain that's going to get down even to the legs. So if we can take the tension off the spinal cord up here, that's what that one study showed, that it can even improve low back issues. It can improve lumbar spinal radiculopathy. So you want to make sure you look at the whole spine, not just one area that you might be having leg pain or arm pain. You want to look at the entire body. That's why I use the approach called EATN, EATN, where we do specific exercises for the spine, the entire spine. We make lifestyle adjustments so then you know how to move, you know how to sleep, you know how to stand, you know how to walk and just sit down, get up, sleep. I already said that. But these lifestyle issues that we have throughout our life, like getting up and down from the chair, making sure that we're doing that in a safe way for the spine. Traction, which you saw a couple examples there of using specific traction to remodel, retrain, remold the ligaments of the spine to hold it there to take the stress off of the nervous system. And then also N, which is nutrition. So that's the EATN method. EATN, the N, nutrition. We want to make sure that you're getting the whole foods, the nourishing foods that will help build the spine, build the nervous system back up, and get rid of radiculopathy, improve on that. But when dealing with radiculopathy, if you've been diagnosed with that, you understand what I mean. If you don't, if you have leg pain, neck pain, arm pain, numbness, tingling, So these can come from different issues causing the radiculopathy as you learn. So you want to make sure that you get the accurate diagnosis, if you will, or the reason for the radiculopathy. And I always recommend chiropractic biophysics, doctors, CBP. I'll provide that link in the description, as well as if you want this spinal hygiene mini class that I created as it follows this Eaton method, definitely type spine in the comments and I will get that to you so you can be your own guarantee for your health and your life.